It was another 2 hours of interactive engagement in the latest government interface with the press as the Minister of Health appeared. Dr. Lamin Samateh highlighted key development under his ministry, revealing plans to upgrade the country's fragile health system.
2 months ago, we laid the foundation stone for 6 health posts, and construction work has started. And inshallah, next month we'll equally lay foundation stone for 8 other health posts. A lot is happening when it comes to infrastructure development. We have equally seen the renovation in Edward Francis Multi-Gene Hospital. I think all of you should pay that place a visit and see the modernization, the expansion work that is going on there, and the modernization of the polyclinic in Banjul. These are all coming on.
The minister outlined key ongoing works at the country's main referral facility, citing essential renovation of infrastructure at the Edward Francis Small Teaching Hospital.
The provision of drugs, yes, it is challenging. Every now and then we hear about we don't have enough drugs here and there. Sometimes it is true, sometimes it is not totally true. But I think we should be cognizant of the fact that every item used in the hospital, all medical items, from drugs to cotton wool to plaster to fluids, everything is imported into the Gambia. Not a single item is manufactured here. Of course, when we depend entirely from outside, challenges are bound to occur. But of course, government over the past few years has intensified the drive to provide medicines of high quality all the time to the people of this country. What has been allocated for procurement of drugs under the leadership of His Excellency since he came into office has already tripled from what we inherited.
Minister Samateh recalled the devastating incident that claimed the lives of over 60 innocent babies, stressing that his ministry is working to ensure medicines and foods imported are regularly tested to save use.
The biggest challenge we have with regards to medicines is the suppliers. I must say here, the biggest challenge we have as a government, and unfortunately, the suppliers are Gambian suppliers who are not patriotic enough. They go through the process, they win the contracts to supply drugs under the GPPA rules, and when it is time to deliver, they dilly-dally until we threaten to take them to court. That has been a big challenge, and so probably some of you are even getting ready to ask that question.
Meanwhile, the minister took time to respond to questions raised by journalists and the public. On the issue of mental health, the minister said plans are underway to upgrade the country's only psychiatric hospital with improvement for the training health experts on how to handle mental health patients.
You are very right. Mental health is a big problem, not just in Gambia, but throughout the world. But it is becoming a bigger problem here. We've seen quite a lot of youth being affected. Quite a lot of, and unfortunately, quite a number of cases we see at tanka-tanka, the psychiatric hospital, are related to substance abuse. So substance abuse has become a very, very big problem for all of us. So with regards to upgrading the tanka-tanka hospital, yes, it is part of our plans. But we are also working on even making it semi-autonomous. That means separating it a little bit, because currently it's being managed by Edward Francis Multi-Gene Hospital. So we said if it gets its own budget entity, if it gets its own management, they will pay more attention to it. And that is very, very near.
The interactive 2-hour engagement was graced by scores of university students and staff of the ministry as students raised concerns on the growing number of challenges undermining health service delivery. Omar Faye, GRTS.